Hello, I'm Harriet Seeger from Radcliffe Cardiology, and we're honoured today to have Dr. Michael Weber with us. Dr. Michael Weber is one of the founders of the American Society of Hypertension and currently editor-in-chief of the Journal of Clinical Hypertension. Welcome, Dr. Weber.
My pleasure, Harriet.
And Dr. Weber, you're going to be talking about the Simplicity trials at the Top 10 in Cardiology meeting on the 2nd of October. I was wondering if you could just tell us a little bit about what you're going to be talking about.
Yeah, Harriet, the Simplicity trials were a very innovative way for treating hypertension, in which we would put a catheter into renal arteries of patients whose blood pressure was not well controlled. And what we would do with the catheter is we would apply energy, electrical radio frequency energy, across the walls of the renal artery to destroy the nerves that go to the kidney, which we believe, on good physiologic evidence, should result in a fall in blood pressure. Indeed, early trials in patients with difficult hypertension showed very encouraging results, big falls in blood pressure. Unfortunately, as we continued some of the research, the results weren't always so clear. And the reasons, we believe, is that there are so many underlying causes for difficult hypertension, the main one of which is that patients simply don't take their medicines. So it's very hard to test a new technique like this and be absolutely certain what's going on. Also, because it's a new technique, not everyone who does it, even experienced cardiologists, get it right. So there's a technical issue as well. The good news is we think we've figured out these problems and we're going ahead with a whole new range of clinical trials.
That's super. So do you know roughly when the new results will be available?
Well, at least 2 of the trials are currently underway, and another 2 or 3 should be getting going in the next few weeks. What's different about these trials, Harriet, is that we're now focusing on everyday hypertension, not necessarily difficult or resistant hypertension, because we believe that will teach us exactly what this innovative kind of interventional technique will achieve in terms of reducing blood pressure. Once we know that, then we can figure out where its place is going to be in the everyday care of people with high blood pressure.
Oh, that's super. In the meantime, I just ask you, are there any sort of other novel medications or technologies in the pipeline as well that we should be looking out for in hypertension?
There are always new devices being looked at. There's a device that stimulates the carotid baroreceptors. That has shown some promise, but that's still also a long way from being available for everyday clinical practice. And even a technique for causing an arteriovenous shunt of the iliac vessels also, interestingly, seems to have some promise. But again, we're not just months, but probably years away from having that available in clinical practice. For the moment, Harriet, it looks as though renal denervation is the next thing to come on the scene that could be available for use around the world somewhere in the next few months or years.
Oh, that's super. Well, thanks so much for enlightening us, Dr. Weber. It's been a pleasure talking to you, and we look forward to seeing you on the 2nd of October in Lausanne.
Thank you so much, Harriet.
Okay then, goodbye.